Hey guys, this is Landon here, and today I have a serious message to all of you guys. And I also have shocking news. Let me start my serious message. To anyone who lives in a US state or whichever country you guys live that is under a coronavirus, please make sure to be safe from the coronavirus. And the first thing you have to do is wear a mask, science glasses, wash your hands, and make sure you cover your mouth as well. And anything like that. So please be safe. And here's my shocking news. So, when I was at school, since 6th period, I heard the 7th graders, and they said that there is a first case of coronavirus confirmed in Montgomery, which is Alabama. I don't live in Montgomery. I only live in Birmingham, which is the city I live. And that made me explode myself. And so yeah, and I'm not even joking. If you want to see proof, here's proof, and watch the whole video and listen to all of this, because this is serious.
This is a WBRC breaking news alert.
Welcome back in, everybody. That breaking news, the first confirmed case of COVID-19 coronavirus now in the state of Alabama.
That is out of Montgomery, and we are awaiting a news conference from the State Department of Health. Right now, the Alabama State Department of Health. Let's listen in as they are at the podium. This is Dr. Scott Harris.
Governor Ivey just released a press release reporting that Alabama has identified its first case of COVID-19 disease in Alabama. This is the first case of a coronavirus infection that we have identified. We have been expecting this for some time now, as you know, and our state began testing within the state just a little over a week ago. We have been waiting to identify a case and finally found our first case this morning. We had a sample submitted to us yesterday afternoon. It was tested overnight, and at about 8 a.m. this morning, we learned that this test was positive. The person who's infected is a resident of Montgomery County. We have already contacted this person's physician, and the physician has notified that patient. We are aware that this patient is someone who had traveled out of state to another state where there is some community transmission going on. Our understanding at this time is that the patient felt unwell on returning home and has self-isolated themselves since they have been home. This person continues to not be out in public or in the community, but is isolated at this time. We have epidemiologists who are already reaching out to make contact with this person and with the healthcare providers of this person so that we can continue to do the contact tracing that we do and try to learn whether there are other contacts that need to be identified or investigated further. I know there have been rampant social media rumors about cases for some time now. We tried to address that somewhat yesterday. I've made some of the media rounds this morning, in fact, reporting our most up-to-date results. And in fact, it was only at 8 a.m. this morning that Alabama has identified a positive test. So we wanted to bring that information to the public as soon as possible. We worked very closely with the governor's office over the past few weeks to make sure that we're carrying out the actions the governor would like us to do. She's been extremely supportive and helpful. She's been personally involved with our preparations and with our activities, and we're very grateful for that. We want to let you know that we have had a plan in place now for several weeks about how we would respond. Given that this is a single case at this time, and it is someone who apparently became ill from traveling out of state, that gives us a certain idea of what our next steps need to be. As we discussed yesterday, we still think it's very prudent for people to avoid large gatherings of people. We gave a number of crowds of 500 people or more yesterday, and we still stand by that statement. I would still say that the absolute number of people at a gathering is probably less important than actually the distance between people. We encourage people to practice social distancing. People need to remain more than 6 feet apart, particularly when you're in crowds, to minimize the disease of any the risk of any disease transmission. We want to remind everyone again about the importance of proper hygiene, particularly hand washing, covering your cough or sneeze. Want to remind you to try to avoid touching your face, and most importantly, we want to remind you to please stay home if you're sick. People who have symptoms need to isolate themselves at home and not be out in public and not around other people, and particularly try to be careful about being around other people who may be at high risk for serious COVID-19 disease, such as elderly people or people with chronic health problems. We have continued to increase our testing ability. As we discussed yesterday, we have increased or we have liberalized the criteria that we are using for accepting tests, and now a physician who has a test that they would like to order on a patient will have that test automatically approved. They are able to, as of this morning or perhaps maybe an hour or so from now, that process will be fully automated so that a provider can go straight online to our website to enter that patient information, have automatic approval for that test to be performed, and then we will be able to perform that as soon as possible. At this time, the turnaround time on our test is somewhere between 24 and 72 hours. I would say that this positive test that we are reporting today actually was turned around much faster than 24 hours, and we appreciate the hard work of our laboratory staff in being able to do that. We have talked to many other groups about any changes in guidance that there might be. I'd like to specifically address a few of them. We have had many conversations with Dr. Mackey and with our school system. We discussed that at a press conference earlier today, and we do not have additional recommendations for them at this time. Dr. Mackey has an excellent plan in place for dealing with cases of coronavirus as they may be found in the community. We think that it is very prudent to avoid large gatherings of people, assemblies and field trips and things like that, and that guidance has already been sent out by the Alabama State Department of Education, but school itself continues for the students, and we think that that's appropriate. We know that nursing homes have begun to implement some changes in their visitation policy, some of them screening visitors on arrival for symptoms, and some of them actually halting visitation for the time being. We think that that's a prudent policy as well, given that the residents of our nursing facilities are those most at risk for serious illness, those people who are elderly or in many cases have chronic health problems. We continue to work closely with our provider groups and with our hospitals in developing a plan to make sure Alabama continues to get through this. We feel like we have a good plan in place. We believe Alabama is prepared. And that's all the remarks I have at this time, but we'll be very happy to take questions from you. Thank you.
How old was
How
old was the person who is infected?
Yeah, the question is, how old is the person who was infected? We're not going to release personally identifiable information at this time. We had announced a day or so ago, I think, that our policy for now is to identify the county of residence of the person, but not to give out any other personal information.
Was this specimen collected through ADPH? Was this specimen tested at ADPH or a private laboratory?
The specimen was tested by ADPH at the state lab. Yep.
Our viewers are wondering why this took so long to confirm a case here in Alabama, given the other states in the country, there were several cases.
Yeah, I think we have tested all the specimens we have received so far. I think we've only been testing for a week. Yesterday was a week. Before that, all specimens had to be sent through CDC, and there certainly was some logistical problems in getting those done there. We would like to find cases sooner, but we have been accepting specimens as fast as we can and turning them over as fast as we can, and today is our first case.
How many test results are in the process right now?
We announced, I think, Tuesday or Wednesday that we were going to open up these testing criteria so that any provider could have a test if desired. Since that time, we've gotten larger numbers of tests. I don't know exactly the number, but I would say we probably have a dozen or so that are going to be run today, and there may be a higher number than that. But we certainly have seen higher numbers of tests being submitted over the past couple of days.
So prior to yesterday, this patient wouldn't have qualified for testing under ADPH guidelines, correct? Because there was no international travel?
No, that's not actually correct. The guidelines that we used before prioritized people who had international travel, but also prioritized people who had other health issues, for example, or people who were seriously ill, for example, and in certain age groups. And so without providing any personally identifying information, I would say this person did qualify, even with our previous criteria.
How do you assure people, we'll probably see panic now that we have a confirmed case, how do you ensure the public here in Alabama that the state has a handle on this?
Yeah, I would say, first of all, this is exactly what we have expected, and we've been preparing for this for several weeks. We've been coordinating with other state agencies, with our other partners in the state, to make sure that we are ready to handle this, and we believe we have that in place. It's always difficult to sort of thread the needle, I guess you would say, between doing something that alarms people, but also being prudent and making sure that we're covering all our bases and being responsible in our recommendations to people. And so I can certainly understand why people would be alarmed. What I would say to the people in Alabama is we have expected to find a case for some time, and we've tried to be very open about that. We're not surprised that we found a case. I guess I don't know why it happened today and didn't happen yesterday or wasn't going to happen until tomorrow, but it's not a surprise at all given what we've seen around the country. We believe the recommendations that we have put out for people are exactly the way people should respond. This disease can really be prevented just based on people's personal behavior in many cases, so we would advise you to do all those things that we mentioned earlier today about hygiene, about avoiding large groups of people, and so on.
State lawmakers approved, and the governor approved $5 million. It's pretty vague in that bill what it's going to be used for. I've been told it's going to be used to create screening centers across the state. How many, and then what else will that money be used for?
Sure. We greatly appreciate the legislature taking the initiative on that, and Governor Ivey supporting that ask from us and from the legislature. That money is money that's made available right away to the state, not only to ADPH, but to the state, so that we can continue with our plan while we're still waiting for federal funds to come down. I know you're aware that last week the U.S. Congress authorized a large amount of money for coronavirus activities. Alabama will see some of that money, but we don't have even guidance on how to spend that for another couple of days. So in the interim, we were very fortunate that the legislature authorized that additional appropriation of $5 million. It will be used in a number of different ways. Much of it will be related to arranging for screening centers to be around the state. The exact number is not certain, but certainly in the 20 to 25 range, I think is what we are initially starting with. These will be sites where that are specifically dedicated to screening people. There will also continue to be sites in probably virtually every county where people can be screened when necessary. The process that we have had to this point is that when we have a patient that we're contacted by from a provider who needs screening, then we arrange for that person to get screened somewhere close to where they live at the nearest location. And in many cases, that's been emergency departments at hospitals, or in some cases, it might be in clinics. So we certainly will continue to be able to do that so that people who live anywhere will have the opportunity to be screened if needed. On top of that, however, screening centers will streamline the process somewhat. We'll have a dedicated site. I think for obvious reasons, you can see why we wouldn't want, for example, lots of people with symptoms going to an emergency department to get screened. And so this will be a way of making sure that they're screened in an appropriate environment. And so we're working very closely with the Hospital Association to get these sites identified. Many of these locations probably will be at or near hospitals, perhaps not literally in hospitals, but many of them have volunteered to do that, and we really appreciate them stepping up to do that. Additionally, there may be county health department sites that are being used as well. At this time, there's still no screening done in a county health department. We need patients who need to be tested to go through their provider, and we can arrange for screening. But at some point, we think county health departments will be part of this screening plan as well. Besides the money going to do that, the money will be used for the same type of coronavirus activities that we are already doing. The things that we are starting today, such as epidemiology activities, contacting patients, tracing contacts, and following up on testing, those are the kind of things that will probably continue as we see more cases, and money will be used for that as well.
Screening centers pop-up?
We hope to have that very soon. The first of the week is when we hope to have a solid plan in place. It logistically will take just a little bit of time to get them up and staffed, but in the next few days we'll have a real clear picture of that.
What's the justification for not releasing the age of this patient? A lot of people are wondering if it's an elderly person or a young and healthy person.
Yeah, what I can tell you, this is a person that had other chronic medical conditions, and so in that case would have been considered high risk. We try not to, for privacy concerns, release anything about sex or age or specific address or other things that could be used to identify a person. So we have made a policy decision to identify where that person lives, whether that person is at risk of others or if they are isolated. And then I do feel free to tell you that it was a person with chronic health problems.
And what's that patient's condition right now?
That person is medically stable to my understanding, but I don't know personally. I know we've communicated with the physician for that patient, and that patient has been notified, and that physician continues to care for that patient.
This may be a question for Dr. Mackey, but Dr. Harris, you mentioned avoiding groups of 500 or larger, but isn't that most schools in Alabama?
Sure, I'll let Dr. Mackey address that. Thank you.
I'd be glad to address that. So we have sent out guidance based on the guidance that came out yesterday from Alabama Department of Public Health this morning about that and about assemblies. So we're talking about 500 or more people who are gathered in a tight space. We do not apply that to the school situation, but what we have told schools is that they should, as quickly as possible, cancel or postpone events. Those might be student plays or performances or student assemblies or assemblies where parents and others would be coming together in large numbers. As long as students are in their classes, moving from class to class, they're not going to be in big areas. But again, so for instance, if they had a student assembly where they planned to bring everybody into the into a conference area or into the assembly hall, the gym, all at one time, we're asking them to go ahead and cancel those kinds of assemblies, but just to maintain the normal operations of school. As Dr. Harris said, it's not so much about the number, 500. I mean, the difference between 500 and 499 is not the difference. It's about those people being together in a tight space. And so we're also related to that, we are working on some guidance that will go out to schools today. Our department over the next several weeks has several conferences where adults would be together for professional learning, and we're in the process of closing down all of those conferences for March and April. And some of them would have had more than 500 people, but some of them would have been smaller, where maybe only 250 or 300 people would be together. But again, together in a conference situation where they're tightly packed into a room. And so we've made the decision to go ahead and begin canceling all of those events for the next 2 months through April 30th. So,
things are being taken in the lunchroom?
General cleaning in the lunchroom. That's a very good question, because that is the time of day when we have more students together. I met this morning with our state child nutrition folks. We're very cognizant of that, working with local school districts to as much as possible continue to push those same things we've talked about. Students going to lunch, they need to wash their hands. Certainly, our cafeterias are some of the most healthy environments in the state, because they're very strict about following public health code. So we know that as food's being prepared, those workers in the cafeteria, they're using gloves, they're using hairnets, they're doing all the things they need to do normally to assist in mitigating the spread of any disease. Because remember, we're having, in schools, we're constantly dealing with sickness. We're dealing with flu every season. We're dealing with colds. We're dealing with lots of things. So we already have so many criteria in place to make sure that cafeterias are not places where sickness is spread. So we feel very good about that, but we continue to reiterate things like washing hands, covering coughs, making sure that if anybody is symptomatic, that they're properly dealt with and treated.
Dr. Harris, I have a question for Dr. Harris, unless someone has one. You mentioned to me earlier this week that viruses are very efficient. How big do you expect this to get? I mean, right now you go to the grocery store and we see bananas are out. I mean, obviously the cleaning supplies, but we see food being stocked up. What's your, you worked in, is it, yeah, how big do you expect this to get?
It's a great question. We don't know how big it will get. I think we can sort of take some hints from what we see with other type of respiratory outbreaks. For example, we have flu seasons every year, as you know. Transmission for this disease is somewhat similar to that, not exactly the same as that, but flu seasons tend to peak for 6 weeks, 8 weeks. Sometimes can go 3 months and then tend to abate. Although we continue to have flu all year long, but we have larger spread at some times of the year compared to other times. I know that we can sort of take a lesson perhaps from China. It's not exactly a perfect correlation, but China has had cases that started probably in December, maybe in November, but certainly by December. Now that it's mid-March, those cases have declined significantly. They really decreased in a significant way. And again, that's not exactly a perfect correlation with what we would see in our country. We would like to think that this could last for 6 weeks or 8 weeks, and hopefully not longer. But it's actually too early to say. As we've said many times, this is a new virus. We don't know everything about it, and time will tell.
Dr. Harris, we have a submitted question. How would it be handled regarding people being exposed at local hospitals? Will they be notified? This leans specifically towards clinical students and teachers in hospitals.
Sure. So if you weren't able to hear the question, it was how will people be notified who may have been exposed at local hospitals, particularly clinical staff at the hospitals? First of all, I would say that hospitals have been preparing for several weeks to make sure that people who work in hospitals are prepared to deal with patients who may have infectious diseases. It's part of their training that they do all the time, and nurses and hospital staff train routinely to make sure that they can protect themselves and stop the spread of disease. Since we have learned about coronavirus, we have done many calls with them to make sure that they feel prepared in terms of their own personal protective equipment, that they have the ability to take care of a patient without putting people at risk, putting themselves at risk. And then finally, I would say that if we identify a case that is in a hospital, then part of the follow-up that we do involves going and talking to the people who've had contacts with that case, working with anyone who may have come in contact in and out of the room, or if they were in a hospital setting, and then we track them and monitor them in a way that we do with any other contact.
Should people start stocking up on food?
Yeah, so should people start stocking up on food? I would say it's not a time to do that, but it's a time to be prudent. People in Alabama are certainly used to getting prepared for different types of situations. We're a big state, and we have ice storms, and we have hurricanes, and we have tornadoes, and I think most people in Alabama understand what routine preparedness is like. And so I think it's always prudent to make sure you have adequate amount of food in your house for a short period, or make sure that you have adequate numbers of your prescription medications, just sort of the routine things that we would always advise people to have. Certainly at this time, we don't have any recommendations about doing anything more than that.
Dr. Harris, you came from the disease specialist field. How does this virus compare to others that you've studied and have seen? This virus is similar to a lot of respiratory viruses that we see. The event I can think of that sort of reminds us of a little bit was H1N1 in 2009. The U.S. really was never affected in as big a way as we thought at that time, and we were very fortunate, even though it was declared a global pandemic. But even working as a physician in private practice, I saw cases of that and had to take care of people in hospitals who suffered with that. I think this in some ways feels similar, but in fact it is a new disease, and we just don't know exactly. We know that the mortality rates from this disease are certainly higher than with influenza, and yet at the same time we know that some different groups are affected a little bit. Influenza is a significant issue for younger people, particularly kids, and for pregnant women. This
current disease, coronavirus, doesn't seem to be an issue for kids in the same way. It's unclear about its effect on pregnant women, but probably not the same as influenza. So, we try to draw lessons from what we've seen in the past, and we have some concept of where we're going, but in fact, it's a new disease, and we still have a lot to learn.
We've heard a lot of complaints about people who said that they've wanted to get tested in the past few weeks and haven't been able to. I understand that situation has changed, but has Alabama done enough to ensure widespread testing up before yesterday, or should the state have done more to get tests out?
Well, yesterday I think was 1 week that we'd been testing. 2 weeks ago, there were only 7 states who were testing within their state laboratories. And so almost no one was testing, and those testing facilities were prioritized in those states that had outbreaks, like the state of Washington, for example, or in, I believe, Nebraska, where some of the first cruise ship patients were taken who were ill. So it's really only been in the last 7 to 10 days that states were able to stand up that capacity. And some of that had to do with how the test was developed and rolled out. There were, you may remember, initially at the federal level, some issues about quality control on the test. And so I think the U.S. as a whole has been slow to roll out testing compared to some places. We do feel now that we have good capacity for our state. As we've told you before, not only are we able to test in our state laboratory, but there are commercial labs that are testing as well. My understanding is there are at least 3 different commercial labs that are testing in Alabama, and they have a capacity of several thousand tests per day they could do if necessary. So the most important thing is to help the public understand when they need to be tested and help providers understand how to make sure someone is tested appropriately. I think that people who don't think a lot about the situation feel like that even if they feel fine and have no symptoms, that they would like to get a test just to know. And those really aren't the best candidates for testing. Because this is a virus that can show up and you could be exposed at any particular time. Even testing you today and giving you a negative result really wouldn't help you tomorrow. And that you'd have to be tested again. So we really want to prioritize people whose healthcare providers think they need to be tested. And in virtually all cases, that would be people who have symptoms.
One more back here. Unfortunately, there's a lot of people in the state that don't have health insurance, and they may be concerned that, hey, I don't have a primary care physician. Where do I go to get tested? How do I get that information? What's your recommendation for them?
Yeah, absolutely. So the people in Alabama who don't have health insurance or who don't have a standing relationship with a provider have been foremost in what we've been trying to develop. I'll say, first of all, there's been great work at the federal level on this. As you know, our national or congressional representatives have been working on a plan to make sure that people do not have to pay for this testing, and that even if they get sick, there have been proposals that their care will not cost them anything as well. That's still being worked out in Congress. At the state level, we are part of the plan that we are working on with this additional appropriation that we found out about yesterday is to make sure that we have a pathway for people who don't have insurance and who don't have a provider, so that we can put them in contact with someone who can help to get them screened if necessary. We absolutely understand that our state has many people that don't have access to that. In the meantime, right now, our recommendation has been, if you do not have a provider, if you do not have a relationship with someone, still start by picking up the phone. Try to call an urgent care, a walk-in clinic, call an emergency department, try to find someone that you can reach that way who can arrange for testing. In most cases, it may not be necessary for them to see you in person in order to do that. But we hope to have a lot more of that issue addressed in the coming days as we roll out this plan.
Dr. Harris, we have an ER-related question. Is there still a screening for testing, or can we test as needed? And do we still call the Alabama Department of Public Health before testing a patient who comes to the ER?
Sure. So there's a specific question about being tested in an emergency department. I would like to, if I could, just clarify the language a little bit. I think there's a little bit of misunderstanding about the language. The test kits that we are talking about and the testing is actually done in a laboratory. Testing is not done in a hospital emergency department. At this time, there are no hospitals doing their own testing, although it's certainly possible that big academic medical centers may use their laboratories to develop tests at some point. and we would certainly welcome that. But the tests are done in the laboratory. The questions that we get a lot about how do I test really should be asked, how do I screen a patient? That is, how do I obtain a sample and get that sample tested? The way to screen a patient is to use a swab that's very similar to what you would use for a rapid strep test or for a flu test. The swab collects a specimen from the nose, or it could be from the mouth, and then it's put in a tube of liquid that's called viral transport media, and then that is shipped on ice to a private lab or to us here at the state lab, and then we actually do the test in the laboratory. Those swabs that are used to collect the specimen and that viral transport media is something that virtually all hospitals will have. In many cases, even private clinics or physician offices would have that, but although everyone may not, and we have a way to get those materials to people who have a patient that needs to be tested if necessary. So we don't expect emergency departments or hospitals or offices to actually be doing a test and give a result to a patient. The testing is done in the laboratory, but we think it'll be very easy to get the materials to people to be screened so that the test can be performed on them.
Dr. Mack. We're seeing on the national level sports cancellations and even some college sports are being canceled. What's the plan for high school athletics?
Good question. So we've been in touch with, and even this morning, had some conversations with the Alabama High School Athletic Association and their executive director, Steve Savarese. They are issuing some guidance today. I don't want to be presumptive on that, but they're following our lead on the gathering of people, basically. So I don't want to say exactly what they're going to do, but as far as having big events where lots of fans would be there, those will be postponed or canceled, just like other activities. That does not mean that every event is going to be canceled. As you know, there are some events that can be held maybe without spectators and some things like that. So I don't want to paint that too broadly, but there will definitely, beginning next week, be a change in the way sports are played throughout the spring.
Okay. Any additional questions at this time? Okay. All right. Well, listen, thank you very much. We appreciate you joining us. We will plan to have some schedule of regular briefings coming up. We haven't quite determined what the frequency that will be, but we'll let you know as soon as we have that arranged. And as we learn additional information, we will make sure that you know. Thank you very much.
See? That's right. Montgomery has a first case of the coronavirus that is confirmed. And I just saw about Governor Kay Ivey from Alabama that they said that all the schools will be closed for 2.5 weeks, and I'm glad. And I only have less than 2 weeks until spring break, and for spring break I am going to Virginia, and yeah, it's just really crazy. So yeah, so if you guys want to put a hashtag for me, like pray for Landon, hashtag let Landon be safe in the coronavirus, or anything like that, please put in the comments below. Well, I hope you guys understand this. And like I said, please be safe and protect yourself, because it's important to be careful. Well, that is all I got to say. This is me, signing off. Goodbye.